Hello, I'm Dr. Nicole Giesken of Giesken Chiropractic. I recently opened Giesken Chiropractic here in Kalida, Ohio in March of 2020. One of my driving forces in my initial career in human resources was I wanted to have the opportunity to help people. My own personal experience with chiropractic changed my life. So my approach in chiropractic care is very relationship-based. It's to look at the individual. It's to find out what their goals are, what drives them, what problem has brought them into my office. And what they'll find in their initial meetings with me is that I won't necessarily, first thing, go straight to that area that hurts, because it might not be about that pain. There might be a different problem within your whole body, within your whole system. And that's what you'll find through your appointment, is that we'll spend a lot of time at first meet with me learning your health history, talking about your experiences, what you do day to day, other factors that could possibly influence your current situation. When a new patient comes into a visit, I often tell them they can expect the visit to be maybe 45 minutes. In some cases, it might be 30, but in others, we might spend a good hour, and I try to allow that amount of time in my schedule. Even most of my intake is more conversation-based. At your first visit, after we spend time discussing what the problems are, what the background is, then we'll do a normal type of exam that you would do at any doctor's office. So we start with your vitals, and then we move on possibly to some orthopedic tests, different range of motion tests I may move you through. And we make sure there aren't any red flags. It's important to me to make sure that your treatment here is safe and it's the best thing for you at this time. Then we do move on to adjustments. In that initial visit, we look at you as the complete person, the whole package. Also, I can find out what are your goals in your treatment. Oftentimes, patients come in for one visit and may find relief, but we often find that the problem isn't truly fixed if it's been caused from a lifetime of trauma, such as bad posture, and it would require subsequent visits in order to really help the area heal. But again, we will decide how many visits based on what your goals are. Patients often say that my care is different than other chiropractors, and part of that is because I use a different technique than many others in the area. I use the activator technique as well as the manual adjustments that many are used to. But the activator, when using it to correct a subluxation, which is what chiropractors call a slight misalignment within the spine, works the same way a manual adjustment does, but it's much faster. So when someone does a manual adjustment on you, what really moves it isn't the force that they're pushing on you with, it's the speed of that force. And with the activator, that speed and that force is the same every single time, and it's much faster than I could possibly do with my hands. It also is a smaller contact surface area. It helps me get the right line of drive and the right angle and the right specific segment so that we know what we're correcting is where the problem lies. So sometimes it's not because we've solved a problem yet. It might still be a journey that someone's under, but for them to leave with hope because they have new knowledge of things they can do themselves, of other avenues of support, of what chiropractic help itself is doing for them. There's nothing better than the surprise and the joy that someone expresses when they've gone, weeks, 6 months, a year with a chronic nagging pain, and they come for chiropractic and they call you, or they come back in and they say, Dr. Nicole, I didn't have pain today, or Dr. Nicole, I slept through the night. I'm amazed, even though I know the science and I know what's behind it. I'm amazed every single time of the possibilities and the benefits that chiropractic can have for individuals.